So look, this is a big day. And before we get to some urgent and still unanswered questions, and there are some legitimate griping to be done, I'm sure, let's begin with some gratitude. The UK has approved the Pfizer COVID-19 vaccine and will begin vaccinating people within 6 days. By any stretch, this is a remarkable achievement of science and innovation and hard work. A deadly, highly contagious, unknown virus that gripped the globe and shuttered economies and killed so many people will within days start to be constrained. This is significant news for everyone around the world. Remember, only 6 months ago, there was speculation that there may never be a COVID-19 vaccine, let alone a number of them that are 95% effective. Still, there remain real questions and questions for Canadians. If the UK is getting vaccinated so quickly, they have an initial batch. It's small by standards, but still an initial batch of 800,000 for frontline workers and care home staff and people over 80. When will Canadians get our first batch? The federal government says some will arrive in early January, but we don't know how many. And what does the approval process look like? And what happens between approval and distribution? And will the news of the UK speed along things? Let's find out. Joining me now is Dr. Supriya Sharma. He is Health Canada's Chief Medical Advisor. And Dr. Sharma, I'm not sure you've been able to sleep in the last 6 months, but I know you guys have been doing phenomenal work. Can you just give your impression, Doctor, and we thank you for your work, about the news out of the UK? Are you surprised Pfizer got that approval so fast in the UK?
So thanks, Evan. And I think, what you said off the top is really important, that it's a marvel that we actually have candidate vaccines so quickly after finding out what the virus is and typing it and finding exactly what caused COVID-19. So we're not surprised because we've been working very closely with not only the UK, but our other regulatory colleagues. We've been sharing information, as soon as we knew that there was the possibility of vaccines being developed, we've been working together on standards. So we knew that we've got a number of different regulators all reviewing vaccines at the same time. And we want to make sure that we're sharing information and making sure that that's as robust a review process as possible.
Okay, so they're planning to start rolling out their vaccine next week. We've heard within 6 days. Can Canada expect, whenever Health Canada finally gives the approval to Pfizer or to Moderna or to any candidate, what kind of turnaround time between approval, distribution, and vaccination? Do we know that yet?
Well, these are all things that are happening in parallel. So just first of all, on the UK authorization, as you mentioned, it really is a temporary authorization of a small quantity, so one lot. We're looking at it more broadly. We're looking at an authorization for the overall vaccine, and they're still waiting to get some information around the specific lots that will be coming to Canada, but the bulk of that review is done. So we're expecting to have that completed soon. But we're not waiting on that in terms of having discussions with the company about what potential supply could look like, and even more importantly, with provinces and territories to make sure that they're ready to receive vaccine and then go ahead and do the distribution. So all of these things are happening in parallel. Of course, no vaccine will get distributed and none will get administered until we've got the Health Canada authorization to show that it has met the standards, what we call safety, effectiveness, and quality. But we're working on all of those pieces simultaneously.
Okay, I'm just trying to understand this because, boy, do folks really want to appreciate this, Doctor. Once Health Canada does the approval, and as you say, it's got to be safe and it's got to be approved, and I appreciate that. At this point, Canada doesn't know how many first batches, how many doses we're going to get in the first batch. And do we know how to deal with those, what the time between the approval, the delivery, and the distribution of those could be? In other words, is that chain, the cold supply chain that would require, say, for Pfizer or Moderna, do we know what that would be? So is it still, at the best case scenario, mid-January for the first dose in Canada?
So all of that really depends on the manufacturing and the supply. And this is really that critical time. So vaccines are more complicated to make than medications because they're made from live organisms. And we really look at the company making sure that they can do the scale up, produce the vaccine, and then do that quality assurance on those lots. And as you said, we are looking at January delivery of a supply. If there is vaccine that is available earlier, and it is the vaccine that's destined for Canada, and it's gone through all of that that quality assurance checks, and we've done our review, then we'll be ready to receive it. So we could conceivably see, potentially see it earlier, but it really depends on the vaccines and the manufacturing.
Right. Again, gosh, I know there's a lot of moving parts here, but just, I think there's a lot of tension as well. How does the UK know how many doses they're going to get already? The governor of New York announced they're going to get 170,000 doses this month. How are those jurisdictions able to give exact numbers of doses and Canada's not?
Well, for the UK, they do have information on a specific lot that they're going to receive. We're expecting to get some of that information over the next few days. We're actually getting information from the company on a daily basis. So it really is depending on when that information for those lots comes forward. Certainly, I think you are hearing a lot of countries talking about what the contracts say in those overall doses. And I think they're making estimates on when they're going to receive that. But for us, it's really, really important that we be very precise. So the review itself is very precise. It's obviously science and evidence-based. We want to make sure that we get that information. As we said, there's some really critical information that's coming in just over the next few days. And as soon as we know when that kind of final authorization will be coming forth, then we'll be able to have those conversations. But we're not waiting for that. We're having discussions with the company around that manufacturing process. And again, this is coming from one plant, and they're really deciding which lots are going to which countries on a day-by-day basis.
Wow. I mean, the pressure is obviously enormous. Let's say that's the X factor from the plant and the lot number and when we're there. I appreciate that. But there are factors that we're in control, and I think a lot of Canadians are wondering why we can't get transparency on the Y and Z factor. For example, the distribution plan, the who gets it first. Again, that was rolled out by the UK. We know, frontline workers will get it. We know people over 80. We know compromised immune system. Why isn't there any transparency on the distribution plan and who gets it first yet in Canada? That seems something we could control.
So there is. So we have the National Advisory Committee on Immunization, this independent group that gives us advice on who the priority groups should be. And they've provided some interim guidance. They're finalizing that guidance now that we have more information about the vaccines. And those priority groups are very similar no matter where you are in the world. So looking at frontline healthcare workers, looking at people with advanced age, people with comorbid conditions or other health concerns. So regardless of where you are in the world, everybody's looking at basically those groups. Yeah. And again, we've got some interim guidance on that, and we'll be having those finalized. We're also finalizing the distribution plans with provinces and territories. And so all of that's coming in line, and we will absolutely share that.
Last question for you, I don't know if this is outside the chalk lines for you, but there's going to be a debate whether this vaccine, when we do get it, should become mandatory or voluntary. Does Health Canada have a view on that?
Well, it's not sort of our usual practice to make things mandatory. Certainly there might be requirements that are put in place, but the most important thing is that a vaccine is only as good as a vaccination, right? So for it to be effective, for it to do what it's supposed to do, people need to get vaccinated. And the most important part of that is that they need to have trust in the system, whether it's the regulatory system or the way that it's distributed. And so we're really relying on, information that goes out to Canadians. We're going to be sharing, as soon as we do an authorization, sharing all of the information that we based our decisions on. So it's really dependent on Canadians, rolling up their sleeves, understanding that this is an important part of the fight against COVID-19 and being part of that solution.
Dr. Sharma, I appreciate your work and your communication today. Thank you so much.
Thank you for your interest. Take care.